From Stockholm, Sweden, this is CardioSource video news coverage of ESC Congress 2010.
Well, we're here again with continuing coverage from the ESC with one of the late-breaking clinical trials just presented, the J-LANCELOT study that looked at a new drug, E5555, a thrombin receptor antagonist. And joining me here today is the senior author of the simultaneously published paper, Dr. Deepak Bhatt. Deepak, do you want to tell us a little bit about thrombin receptor antagonism?
Absolutely. So the PAR1 receptor is a thrombin receptor, and as it turns out, thrombin is the most potent platelet agonist there is. Other platelet receptors have been explored. Aspirin, of course, works on a platelet receptor. ADP receptor antagonists, clopidogrel, prasugrel, ticagrelor, are all being evaluated or have been evaluated extensively. But the PAR1 receptor has been a promising receptor in animal studies, preclinical studies, but only now is entering phase 2 and phase 3 testing.
Great, and this drug E5555 is a new one. Can you describe it a little bit?
Absolutely. So its name, actually, and it has been named very recently, is atopaxar. There's another drug in the class, vorapaxar, that's being studied in 2 phase 3 trials. Atopaxar is being studied in phase 2 studies. At this meeting, Professor Shinya Goto presented the results from J-LANCELOT, which in fact are 2 different trials, a study of acute coronary syndromes and a study of stable coronary artery disease. There are 2 parallel, larger international trials that will be presented at TCT, but these Japanese data have been presented at the European Society of Cardiology.
Well, that's terrific. And so I guess there are platelet data and some clinical outcomes that have been presented.
Absolutely. So it's a phase 2 study, of course not powered for clinical events per se. The primary goal was to evaluate the safety, and overall the safety looked pretty good. In terms of major bleeding, there was no significant difference between placebo and the drug. In terms of more minor nuisance bleeding, there was an effect, which actually in a phase 2 trial I interpret as a good thing because it shows that the drug is actually working. It would be a little bit disquieting if there was no effect on any sort of bleeding, but fortunately no bad bleeds that were induced by the drug, more so than placebo. In terms of MACE, major adverse cardiac events, of course phase 2 trials aren't powered for that sort of thing, but there were some numerical trends favoring drug versus placebo. Importantly, there was a platelet sub-study, actually a fair amount of patients got the platelets PK/PD work done, and this showed, quite interestingly I think, a profound effect on thrombin receptors by this agent that was dose dependent. So it appears that the doses, and there were 3 doses studied here, have really identified what might be a clinically effective dose to study in a large phase 3 trial.
Oh, terrific. And any other safety data that came from this initial phase 2 study?
Yes, there were observations made where there's a slight effect of QT prolongation on the higher dose and also an effect on LFTs with the 2 higher doses that were studied. There does seem to be a dose-dependent effect. Reassuringly, however, none of those LFT abnormalities progressed to so-called cases of Hy's law or liver failure, and the QT prolongation was really relatively minor and was not associated with syncope or malignant arrhythmia. So at least within the context of a phase 2 program, nothing bad happened in association with it. But obviously in a phase 3 trial, this would need to be studied much more carefully.
Terrific. Well, it's exciting to see these initial data, I guess more data coming at TCT, and nice to see Japanese data coming in parallel with other data coming soon on a promising new agent.
Absolutely.
So from the ESC with continuing coverage, I'm Cannon for CardioSource Video News.